Many cases of community-acquired pneumonia begin with a simple cold or flu. So one important way to avoid pneumonia is to maintain good overall health and to keep the immune system functioning normally. Smoking is the most important risk factor for community-acquired pneumonia, and it's under the individual's control. Also, excessive alcohol consumption increases the risk of community-acquired pneumonia. Nutrient deficiencies and malnutrition are common in older people, and they contribute to the pneumonia risk, but they might be preventable through a well-rounded, nutrient-dense diet and dietary supplementation. Substantial evidence indicates that engaging in regular physical activity diminishes some of the negative effects of aging on the immune cell activity, and physically active seniors have fewer infections than the sedentary counterparts. Exercise is thought to exert these benefits by activating immune cells, helping to expel bacteria from the airways and to reduce stress. Regular hand washing is recommended as a strategy to avoid respiratory infections. Regular water or saline nasal irrigation can help to keep respiratory infections at bay. Once pneumonia has set in, adequate water intake is especially important for keeping the muscles in the lungs loose. In addition, getting plenty of rest until the symptoms are completely resolved can help to prevent a recurrence. Because harmful bacteria in the mouth can be aspirated into the lungs and cause infection, poor oral hygiene is associated with a higher risk of pneumonia. One study that assessed the rate of respiratory illness among a group of older adults showed the importance of poor oral hygiene. During a 6-month period, only 1 of 98 adults who utilized dental hygienists for oral health developed respiratory infections, compared to 9 people who didn't receive the same preventative dental care. In addition, a daily water gargling habit has been found to reduce the incidence of upper respiratory tract infections, perhaps by keeping infectious microbes from sticking to the oral surfaces. Gargling with salt water can also help to prevent respiratory tract infections, which often precede pneumonia. When hospitalized patients require assisted ventilation for 48 hours or more, their risk of developing hospital-acquired pneumonia increases. Meta-analyses of randomized control trials have concluded probiotics can help to prevent the hospital-acquired pneumonia in the critically ill patients and lessen the incidence and the duration of upper respiratory tract infections in healthy adults and children. A double-blind, placebo-controlled trial on more than 200 healthy subjects tested if probiotic formulas impacted the rate and the severity of respiratory illness over 3 winters. The trial used formulas containing multiple strains of lactobacilli as well as Bifidobacterium lactis. The frequency, severity, and the duration of the respiratory illness during the cold and flu season was significantly reduced in the probiotic group compared to the placebo group. Since many cases of bacterial pneumonia are preceded by upper respiratory tract infections, preventing these milder infections can reduce the pneumonia risk. Probiotics are also useful for minimizing the side effects of antibiotic therapy, including diarrhea and Clostridium difficile infections. Ganoderma lucidium, commonly known as the reishi mushroom, has a long history for treating conditions related to inflammation and low immune function. Because of its balancing effect on immune activity, the reishi is considered an immune modulator. The reishi polysaccharides have been found to stimulate infection-fighting immune cells. Substantia deserticola has been used historically in traditional Chinese medicine to stimulate the immunity in the elderly. The Substantia Glycoside includes the compound echinocide as well as a Substantia polysaccharide, and these have demonstrated immune-enhancing effects. An extract of Substantia was found to increase the lifespan and to stimulate immune cell activity in mice with immune senescence. Because immune senescence plays a key role in pneumonia susceptibility in older individuals, the Substantia holds promise as pneumonia preventative in the elderly. Pu-erh tea has been traditionally used in China for centuries for a wide range of health benefits. It was found to enhance immune cell activity, while decreasing the inflammatory cytokine interleukin-6 in mice with immune senescence. This immune modulatory effect gives the pu-erh a potential as a pneumonia preventative in aging adults. Data from the National Health and Nutritional Examination Survey showed the occurrence of community-acquired pneumonia was higher in people with a low vitamin D status. In another study that followed over 1,400 people between the ages of 53 and 73 for an average of 10 years, those with the lowest vitamin D levels were 2.6 times more likely to develop pneumonia when compared to those with highest vitamin D levels. Very low, less than 15 nanograms per milliliter of 25-hydroxy vitamin D has been associated with a 2.6-fold greater odds of hospitalization for community-acquired pneumonia. Furthermore, a vitamin D deficiency can increase the risk of death in hospitalized patients with community-acquired pneumonia. An ongoing randomized placebo-controlled double-blind clinical trial called the Lung Vital Study is examining whether supplementing with 2,000 international units of vitamin D plus 1 gram of omega-3 fatty acids per day can reduce the pneumonia risk. An analysis of randomized control trial data found that vitamin D supplementation reduced the odds of respiratory infection by over 40%. These benefits may be partly explained by vitamin D's ability to increase the antimicrobial immune activity. Also, a vitamin D deficiency is associated with fewer immune cells in the blood, increasing the susceptibility to infection. Vitamin D is also an immune modulator, and it's involved in stimulating the innate immune activity and regulating tissue-damaging inflammation. Poor zinc status, which is commonly found in the elderly, is associated with impaired immune function, decreased defenses against microbes, increased duration and incidence of pneumonia, and greater use of antimicrobial treatments. Low zinc levels are associated with an increased rate of death from all cause in the elderly. Because zinc is needed for the normal cell division and development, it's especially important to cells that replicate rapidly, such as the immune cells. In a 1-year study, nursing home residents with lower zinc status were found to have almost twice the risk of pneumonia as those with a normal zinc status. In addition, pneumonia lasted longer, and more antibiotics were used in the low zinc residents when compared to the normal zinc counterparts. The study subjects with adequate zinc levels were at a significantly lower risk of dying from any cause. In an animal model, mice who were fed a zinc-deficient diet were dramatically more likely to die of infection with Streptococcus pneumonia and have evidence of lung infection with Streptococcus pneumonia when compared with the mice who were fed zinc-adequate diets. Zinc supplements can reduce the duration and the severity of upper respiratory tract infections. In one trial, volunteers with a recent onset of cold symptoms were treated with 13 milligrams of zinc in the form of an oral zinc acetate lozenge or placebo every 2 to 3 hours during the day. The zinc-treated subjects had less severe symptoms, and they recovered on average 3.1 days sooner than the placebo-treated subjects. In a similar trial, taking a lozenge providing 12.8 milligrams of zinc acetate every 2 to 3 hours, beginning within 24 hours of developing a cold, was associated with decreased severity of symptoms and a 3.6-day reduction in the duration of the symptoms. Zinc may also be useful in prevention. A randomized controlled clinical trial in adults aged 55 to 87 found daily supplementation with 45 milligrams of zinc gluconate for 12 months was associated with lower incidence of infection compared with a placebo. Since pneumonia is often a complication of upper respiratory tract infection, preventing colds or reducing their severity can help protect against pneumonia. In a 1-year controlled clinical trial, over 600 elderly nursing home residents were treated daily with 200 international units of vitamin E or placebo. Those receiving vitamin E experienced fewer common colds. Another study following elderly patients who were hospitalized with community-acquired pneumonia found taking vitamin E supplements was associated with a 63% lower odds of re-hospitalization after discharge. Based on work in animal models of susceptibility to infection in the elderly, vitamin E appears to exert its protective effect against bacterial pneumonia through the modulation of immune function. Vitamin E is not a single compound, but rather it comprises of several related compounds called isoforms. A combination of natural tocopherols might possess greater health-promoting properties when compared to isolated alpha-tocopherol. Gamma-tocopherol in particular seems to be an important contributor to some of vitamin E's health benefits. Green tea is rich in polyphenolic compounds called catechins. A major catechin in green tea, epigallocatechin gallate, or EGCG, has demonstrated antiviral action against the influenza virus, and it's been shown to activate antibacterial immunity against Legionella pneumonia in vitro. The green tea catechins have demonstrated important antimicrobial activity against oral pathogens that cause periodontal disease, and this might be a risk factor for developing bacterial pneumonia. A study followed older subjects for 12 years, and it found the women who drank 1 cup or more of green tea per day were 41 to 47% less likely to die from pneumonia than women who drank less than 1 cup of the green tea per day. Drinking 1 to 5 cups of green tea per day was found in another study to reduce the risk of influenza, a common prelude to pneumonia in schoolchildren. In a controlled clinical trial in nearly 200 healthcare workers, a green tea extract providing 378 milligrams per day of green tea catechins and 210 milligrams per day of green tea-derived amino acid theanine was compared with a placebo. The subjects in the green tea group had a 75% fewer influenza infection over a 5-month period. Gargling with catechin-rich green tea can also be effective to prevent respiratory infections, including influenza. In a 3-month study, 148 nursing home residents were assigned to gargle regularly with either a solution containing the green tea catechins or a catechin-free controlled solution. Only 1% of the residents in the catechin group contracted influenza, while 10% of those in the control group became ill with the flu. N-acetylcysteine is a precursor to glutathione, one of the body's essential oxidative stress modulators, and it's been studied in bronchitis, cystic fibrosis, and other lung conditions because its expectorant and mucus thinning actions. N-acetylcysteine supplements increase the body's stores of glutathione, and evidence indicates that N-acetylcysteine improves immunity and it modulates inflammation. In a 6-month trial with 262 participants, most of whom were 65 or older, only 25% of those taking 600 milligrams of N-acetylcysteine twice a day developed the influenza symptoms, compared to 79% of those in the placebo group. The N-acetylcysteine treatment significantly decreased the severity and the frequency of the influenza-like episodes, and it reduced the time spent in recovery. Influenza often precedes community-acquired pneumonia, suggesting the N-acetylcysteine might offer some protection against the pneumonia in the older adults. A combination of L-cysteine and another amino acid, L-theanine, found in the green tea, can also protect against viral infections that could lead to pneumonia. Taken daily for 14 days prior to vaccination, 700 milligrams of L-cysteine and 280 milligrams L-theanine improved the immune response to the influenza vaccine to a greater degree than a placebo in nursing home residents. In another trial, healthy men taking 350 milligrams of L-cysteine plus 140 milligrams of L-theanine twice a day had 58% fewer colds in a 35-day period than those who were taking the placebo. Echinacea is an immune modulator, and it can stimulate antimicrobial immune function, but inhibit the overly inflammatory immune activity. A rigorous analysis of randomized controlled trials of echinacea preparations concluded the echinacea can prevent repeated respiratory infections and their complications, including pneumonia. The analysis also determined that using higher doses of echinacea during infections improved its efficacy. Preliminary research suggests the early treatment of cold symptoms with echinacea can speed up recovery. The early treatment of influenza with an echinacea preparation was found to be as effective as the antiviral medication oseltamivir. Individuals at a high risk of pneumonia due to chronic respiratory conditions can benefit from the use of echinacea. In a pilot trial, adults with pre-existing chronic respiratory conditions were treated with either the influenza vaccine, a standardized echinacea extract, or both. Those treated with the echinacea extract, with and without the flu shot, experienced fewer flu-like symptoms and had fewer respiratory complications during the study period compared to those who only received the vaccine. Some trials have found a benefit to vitamin C supplementation for the prevention of pneumonia, and a review of trials of vitamin C for the common cold found a reduction in the severity and the duration of the colds. Serum levels of vitamin C have been found to be lower in patients with pneumonia than in healthy people. Even a modest dose of 200 mg per day was shown to raise the serum levels and to improve the symptomatic condition of the individuals with acute respiratory infections. Vitamin C has been shown to reduce oxidative stress and levels of inflammatory biomarkers in a preclinical model of severe community-acquired pneumonia. In a controlled clinical trial lasting 3 months during the winter, the volunteers taking a garlic supplement had fewer and shorter colds than the volunteers taking a placebo. In another randomized controlled trial, healthy subjects taking an aged garlic extract reported fewer and less severe cold and flu symptoms, and less school and work days missed. Furthermore, blood tests after 45 days showed superior immune cell proliferation in the garlic extract group when compared to the placebo. In a preclinical study, garlic extract demonstrated antibacterial action against both Staphylococcus pneumonia and a less common cause of pneumonia, Klebsiella pneumonia. A randomized controlled trial published in 2016 investigated the effects of aged garlic extract supplementation on the incidence and the severity of the cold and flu. 120 participants were randomized to receive aged garlic extract at 2.5 grams per day, or placebo for 3 months during the cold and the flu season. After 45 days, specialized cytotoxic T cells, called gamma delta T cells, and natural killer cells from the garlic recipients proliferated better and were more activated than those from the placebo recipients. After 90 days, those who received the aged garlic extract reported reduced cold and flu severity, fewer symptoms, and less absenteeism from work and school. Coenzyme Q10 is found in all metabolically active cells in the body. Supplemental CoQ10 can benefit people with pneumonia by inhibiting inflammation, improving cellular energy metabolism, and modulating oxidative stress. In one randomized controlled clinical trial, older adults who were hospitalized with community-acquired pneumonia were given either 200 mg of CoQ10 daily or placebo in addition to antibiotics for 2 weeks. At the end of the trial, it was noted that fevers had resolved more quickly, hospital stays were shorter, recovery rates were higher, and treatment failure rates were lower in the CoQ10 group when compared to the placebo group. For more on herbs, supplements, and natural treatment plans, check out my website.